Well, thanks everyone. Welcome to this webinar through the MTSS Center on Significant Disproportionality as it relates to MTSS. I'll introduce myself here in a second, but within the chat, if you could put your location and what brought you here today. And that. So my name's Jason Harlicker. I'm the director for the MTSS Center. So we appreciate you all joining us. I'm going to go over what the center is just on a couple of slides and get you ready for our speaker here. So appreciate folks putting things in the chat. Just take a look and see here. Pennsylvania was born there, so good to see Pennsylvania folks. We got Santa Fe, Georgia. Now it's going way too fast. Looks like representation all over, so that's great. I see Oregon, Georgia, Pennsylvania, Illinois, D11. I'm actually in Denver, so good to see Colorado on here. Great. Well, welcome again, everyone. So this webinar is courtesy of the MTSS Center. So real quick, the MTSS Center is a national center through American Institutes for Research. So we offer a lot of professional learning and coaching and training to sites. We have 25, 30 staff members. So we are able to sort of customize people's needs in relation to where they're at and to a particular staff member. Regardless of the services you may or may not access through our center, we do have a lot of free resources, as well as the webinars that we offer. So today we're obviously doing a webinar, but we also have some other ones that are recorded. So feel free to use the link there on the screen or the QR code and kind of poke around and see our different services. I want to share real quick just kind of how we approach the work and think about MTSS at the center. We really start with this idea that in order to implement MTSS well, you have to have the mindset and sort of belief among your staff in MTSS and your ability to not only implement MTSS, but impact the lives of students. So one of the things we start with is building that mindset and belief around MTSS. We know MTSS involves, evidence-based practices and selecting tools and looking at data. But before we get to all that, we really want to start with that belief and mindset behind it. One of the big beliefs that we have is how students learn, and that's depicted on this graphic on the screen. We really look at the instruction, the curriculum, and the environment. Ideally, all of that works together to support students or learners in the middle there. If a learner or a group of students aren't progressing, then we really want to look at, well, where's that breakdown among that instruction, the curriculum, and environment? And so we kind of have this high collective efficacy among staff where we view learning as the ultimate goal. We spend a lot of time communicating and building collaboration among staff and really building those systems in place to implement MTSS. How we go about building, we start with what does it look like? All of us, I think, are familiar with the idea of when you're implementing MTSS, you have to figure out what screening tools you're going to use, what progress monitoring tools, the different curricula and evidence-based practices that you might use. But there's two other pieces to this equation, not only what it looks like, but also how will you support it. It's all that supportive infrastructure and mechanisms that sometimes kind of sit behind the scenes, but we also, they sit behind the scenes, but they're also very critical in terms of supporting the design of MTSS. So we ask, what does it look like? How will you support it? And then the third question is really around, how do you stay on track? What is that data that you're gathering to see if you're implementing well or implementing as intended? So we'll look at both fidelity and student outcome data. And I grew up, my father worked a lot on cars, so I have a lot of car and medical analogies when it comes to MTSS. So for this one, I'll share a medical analogy. You can think about what it looks like or the design as the type of car or the model and make that you might drive. But then you also know as a car, you have to have the regular maintenance or put gas or charge your battery in it. So that really speaks to the how will you support it. So are you doing regular maintenance? And then how do you stay on track? It's all that data and information you get from your dashboard in terms of the vehicle you're driving there. So we try to think of MTSS with implementation, not just the mindset and the readiness to implement, but then when we're actually implementing, trying to address what will it look like, how will we support it, and then how do we stay on track with implementation. So again, feel free to check out our website and access a lot of the different resources that we have there. We'll put that in the chat here in a second. For today, before I turn it over to our main speakers, please keep your microphone muted when not speaking. I don't think that's an issue actually on the webinar. Use the chat box for questions. So we have the chat box available, and then you can ask more direct questions using the Q&A feature. We ask that you just stay engaged throughout. Certainly want to use your time in a good manner here. So, and I don't think the camera is an option to have that on, but hopefully you all stay engaged, and then that helps our speakers with that. So it's my pleasure to introduce Sarah Benz. Dr. Benz provides technical assistance and professional learning to states and school districts on data-based individualization, inclusion, significant disproportionality, and MTSS. She has unique expertise in significant disproportionality as she provides professional learning on inequity to dozens of districts and schools. She's also a leader in school improvement for disproportionality, having secured over $9 million in funding on projects related to inequity. She also provides leadership and technical assistance through the National Center on Intensive Intervention, the National Center on Systemic Improvement, and various Texas state projects. So prior to joining AIR, Dr. Benz supported research projects where she collaborated with multiple elementary schools to implement MTSS for academics, behavior, and social emotional learning. She has also taught middle school special education for 6.5 years and is a former district director of special education. So I'll stop sharing and please welcome Dr. Benz.
Thank you, Jason. I appreciate it. And I see so many friendly names on here already. So it's so exciting to kind of be here today to talk about one of my favorite topics. And so to kind of kick this off for today, I want to do some level setting or for some goals. As I look at some of these names in here, you guys are probably more expert in SIGDIS than I am. But I see also so exciting, a lot of educators have joined too. So really exciting today. I hope we can spend some time understanding what significant disproportionality is and really those federal and state landscape of SIGDIS. I also want to talk about how MTSS, so the multi-tiered system of support, can help prevent SD. But if you are in a situation, which I see from the chat, some of you are, how you can use your multi-tiered system of supports to address some of those components of SD. And then I want to leave you with some resources. So if you're at the state agency, or even if at district or campus, I want to make sure that you know how to reach out for support in addressing or preventing your significant disproportionality. So before we get too far into this, I thought we would discuss a little bit more about what are the exact IDEA requirements on significant disproportionality. So to do that, let's define it. What is significant disproportionality? So significant disproportionality, or SIGDIS or SD, is the overrepresentation of students of any racial or ethnic group that's identified for special education placed in more restrictive settings. So think that resource room or that out-of-school placements, or when students with disability are disciplined at higher rates than their peers in other racial ethnic groups. So really specifically, when you think about significant disproportionality, it has this attachment to federal requirements, but then the data is limited to just students with disabilities. And so, as mentioned, really significant disproportionality is mandated federally, but it's monitored at that state level. So on your state reports, you'll see that you get this determination around where you are on significant disproportionality. In so much so that states must set a minimum risk ratio threshold over which a district is considered to be significantly disproportionate. This risk ratio, it's complicated, so I hope y'all like math, but a risk ratio is really a numerical comparison, right? It can be expressed as a ratio or decimal, but it really is comparing the risk of a specific outcome for a specific racial or ethnic group on a campus or district, and the risk of that same outcome for children in all other racial or ethnic groups within that campus or district. So with a risk ratio, every state sets a threshold and determines their significant disproportionality if districts then cross that threshold. I find it easier to understand what a risk ratio is through this example here. So for example, if you have 40 out of 200 students with disabilities are students that are Hispanic identified as with a specific learning disability, that means then that they represent 20% of the students with disabilities, compared to if there are 200 out of the 2,000 students in that district, then the risk of being identified is at 10%. So if you do a little math, the risk ratio for Hispanic students in that district being identified as SLD is 20 divided by 10 or 2.0. So if you had a risk ratio set at your state of 2.0, you would be at that risk ratio threshold. So let me pause here. Do you know your state's risk ratio? So I'll just pause just for you to reflect. You don't have to put it in the Q&A or anything, but if you don't know it, I suggest you look on your website for your state and figure out what that risk ratio threshold is. All right, so what if you're found to have some significant disproportionality? What do you need to do? Well, the law further states that you have to do the following. States must provide campuses and districts with steps to be able to review policies, practices, and procedures that may contribute to their specific area of significant disproportionality. Also attached to this is kind of a monetary consequence. So all identified LEAs, so districts, campuses, must reserve 15% of their IDA Part B funds to provide what's called comprehensive coordinated early intervening services to serve all children in that district, but particularly those in the significantly over-identified groups. Now, this can be used for activities that identify and address factors that contributed to the SD. So think professional development, think education, behavioral evaluations, think services and other supports. But then LEAs must use CCEIS, so that comprehensive coordinated early intervening services, and they must track and report how much funds were set aside and used to address significant disproportionality. So since so much of the requirement is on the state to set the risk ratio, to really to provide campuses with these how to review policies, to review practices, we kind of wanted to know how are states helping districts to address significant disproportionality requirements. So we launched this bigger question, and I want to turn it over to my colleague who did the work, Swati. She's a research associate at AIR, and she's going to spend a little bit of time unpacking with us a very small part of this data set that we uncovered. I think we could spend the next webinar talking about this super big landscape, but we're just going to give you some highlights in case you're in part of those states, but also to see there's not a ton out there. So Swati, I'm going to turn it over to you to kind of give us the lay of the land.
Cool. Thanks, Sarah. Hi, everyone. As Sarah said, my name is Swati Gwynn. I'm a research associate with the American Institutes for Research, as well as the coordinator for the MTSS Center. So now that Sarah has kind of gone over the law, we know it's a federal requirement for SEAs to provide districts with steps to address significant disproportionality. And so early last year, we really wanted to get a lay of the land on what exactly states are doing to provide districts and schools guidance on how to do that and how to monitor their progress. So often, since SEAs use websites as prime sources of information, guidance, resources for LEAs, schools, and just the general public, we decided to conduct a website scan to uncover kind of national trends on how states are tackling SIGDIS in response to this federal requirement. So an important note, we really focused on resources and information created by the SEA within the past 10 years. So not really like anything they posted that was created by a third party and linked to the website, things that were created by the SEA specifically. And I also wanted to acknowledge that there may be a lot of additional resources and information that the SEA is offering that isn't publicly available on the website. Our analysis just kind of included what was publicly available. So we went on each all 50 states plus DC, all of their websites, and just kind of broadly looked for any information they provided on significant disproportionality and how to address it. So with the next slide, Sarah mentioned that every SEA has a minimum risk ratio threshold. So that's a requirement. So we wanted to kind of get an idea first on where all 50 states and DC kind of stood in setting their ratio. So kind of we wanted to know, because depending on how high or low that ratio is, it can really impact how many districts the state is identifying. So as you can see here, as of early 2023, a majority, 23 states set their ratio at a 3. A much lower number, 10 states had different risk ratios for different categories, so they had multiple. And then the numbers really varied from there, with the highest at 4 and then the lowest at 2. So with that information, we looked at what is on the web. Now that we know kind of what the risk ratios are, we wanted to see where exactly SEAs were holding information on their websites about SD. So like, how front and center is it? Is it something you really have to dig for? So again, a majority, 23 again, had an independent landing page focused specifically on SD and or CCEIS funding information. So it was really great to see that so many states had a dedicated page for this information specifically. 6 states had information included on like a different topical page, like a page specifically for special education. We found 10 states had independent documents kind of uploaded on the website somewhere, but they didn't live on like a specific web page. You could just kind of find it through the search bar. And there are 12 states that had nothing at all. So most of these, the web page usually included information about the methodology of how to calculate your school or your district's risk ratio, an explanation of the federal law, and categories of the SD. So that's like disability types and racial and ethnic categories that are used. What we found less commonly, though, is that some SEAs publicly offered recent data on each district's SD status or an implementation timeline for how to address SD, what you're expected to do after you've been designated. All right, so technical assistance support. So when we looked into these pages, we really found a good number of states offered more than just information, but also offered TA support kind of in this format of workbooks, forms, tools for LEAs to complete by themselves after they've been identified as having SD. So we found that 17 states provided tools for self-study on the factors contributing to SD. So that often includes guidance on completing a root cause analysis, such as IDEA's data centers. There's success gaps rubric that was often used. As IDEA mandates that SEAs must provide LEAs with a method to review and revise policies, procedures, and practices, as Sarah had mentioned earlier, we found that 9 SEAs posted workbooks and forms that have to be submitted to the state as a form of records review. And 9 SEAs also provided planning and monitoring toolkits to track data on students that were benefiting from CCEIS funds. So kind of tracking where that money is going and how it's being used. So I kind of listed 2 examples on this slide of the kind of TA support we found in Washington State. There's a self-study checklist that kind of crosses across those 5 domains I have listed there. And it's a really extensive Excel sheet. Colorado has a 5-step workbook that must be submitted to the SEA. And that helps them identify SD factors, review their practices, and manage CCEIS funds. So these are like publicly available documents that all districts are able to use to help them with their identification. All right, so other guidance and resources. So outside of these kind of self-study tools, several states also created kind of informational fact sheets on CCEIS or SD, or like an external resource list to guide LEAs on how to learn more. So they created their own list of like, here's other places where you can find more information. What really stood out to us, though, was that there were 10 SEAs that created their own webinars and learning modules. So I've given a few examples of those, and I'll also put the links to those in the chat. Idaho created a series of 6 modules that kind of covers data, timeline, fiscal requirements, and these modules are open to the public. Anyone can complete them. Let me put this link in the chat. Pennsylvania and North Carolina separately hosted their own webinar series that you can view the recordings for. Pennsylvania focuses on 6 equity pillars of practice related to SD, and North Carolina has 10 different external speakers that come in and address a topic related to SD. So they're really great. So here's Pennsylvania's, and then here's North Carolina's. And let me know if these links don't work for some reason. So feel free to check those out. They're a great amount of information, and it's really great that the states created those. So technical assistance support, our biggest takeaway, though, is that we only found 7 states that offered comprehensive training and coaching systems for SD. And I want to say again, like, this is just from what was publicly written on their website. Other states may offer this and just not have listed it on their website explicitly. But this includes kind of individualized guidance and selecting evidence-based practices and interventions to address the root causes. And from what we found, the kind of examples that states offered was, one had like an annual 2-day institute to help LEAs analyze data. Some states had like trained TA facilitators that could provide individualized technical support. And some offered even like communities of practice and targeted workshops. So those are really great. And overall, we found just kind of over our entire study here that most SEAs kind of offer basic information on the federal regulation around SD, you know, how to calculate risk ratios, what LEAs are required to do once they're identified, but kind of beyond federal compliance, only a few SEAs created actual opportunities for further support in addressing their designation, such as this kind of like coaching and training and workbooks and tools for self-study. So since so few states are offering this kind of comprehensive TA, this is kind of a good place for me to turn it back to Sarah to talk about how you can leverage MTSS to prevent and address SIGDIS and how AIR and the Center on MTSS can help.
Yeah, thank you, Swati. I really appreciate that. So here's what y'all came for, right? So when I started doing this work, having the background in multi-tiered system of supports, I started doing significant disproportionality work. And every time I was faced with an identification issue, a placement issue, a discipline issue, I'd say, the answer is working on your MTSS framework. And I would say that's about 95% correct. There are other things that need to come together to be able to fully grab and dig into those complexities around significant disproportionality. But it made a lot of sense to start thinking about, with only 7 states giving some sort of technical assistance. I mean, professional developments are great, but even if I had fireworks here, you may not walk away and remember this webinar. But if I'm coaching you around these key factors, you're much more likely to implement those. And so when we were looking and saying, well, how can the Center on MTSS kind of help folks as they're either preventing or in the space where they have to be addressing significant disproportionality, it made sense to kind of put these 2 things together. So we're going to unpack in the next few slides a little bit of how we can leverage the MTSS framework to prevent and address significant disproportionality. There's about 75 days worth of content here, but I want to leave you with 3 things that I think you can hear today, start doing tomorrow, and then we'll spend some time unpacking that together. First, if this is your first MTSS Center webinar, welcome. We do want to make sure that we level set what is multi-tiered system of support as we think about it from a national level. So we define MTSS as these 4 key components that you see here in the dark blue circle. So progress monitoring has to be a part of it. You have to do some screening. You're making those database decisions, and you have to have some sort of multi-level prevention system. We have those, like I mentioned, in the dark blue, but then we have the infrastructure that is super important surrounding, and it supports the mechanisms around all of those components. So when you're looking at them, culturally responsive, ensuring there's an evidence base, that you're building professional capacity. And so in that, we really think MTSS builds the system to meet all needs of a student. Essentially, I like to say MTSS is how we do school, right? This is the framework in which you're doing school. We also don't don't ever try to talk about things such as a tier 2 kid or a sped kid, right? That's kind of, we don't want to stick in that mindset. We're proactively and trying to prevent students by hooking them up with varied levels of intervention. And then our view of MTSS is it really grew out of parallel movements. So I think there are very few states, but some are out there that still talk about RTI and PBIS. But when we talk about it, we're talking about RTI in the academic sense, PBIS in the behavioral sense, and merging those two things together. And so again, as I mentioned, when you have a healthy MTSS framework that's implemented with that fidelity, those core components that Jason outlined at the beginning of our webinar, it can really help to prevent those issues of significant disproportionality, especially, I want to say, in identification and discipline. However, once you're a district that's been found to have significant disproportionality, I think working on your MTSS can really help address those key components. And so specifically, we're going to talk about 3 ways today. So again, we're approaching this as it's a systemic approach to addressing the needs of all students in your system. So we're just going to barely scratch the surface of how you can leverage your MTSS to prevent and address issues of SD. And these 3 ways, I'm thinking that can be something you hear today and start doing tomorrow. And I'm going to highlight an example from each of those equation components that Dr. Harlicker highlighted at the beginning of our webinar. So first, MTSS provides a systematic approach to providing early intervention and support for all students, right? Second, the decisions about students, and this is the beauty of MTSS, that they're made using data and they're made using a team-based approach. And last, you can really leverage your MTSS to prevent or address those issues of significant disproportionality by focusing on those discipline alternatives. So we're going to dig into each one individually, and I'll ask you some questions on each one, and I'll try and keep up with the chat. Oh, Dr. Quinn, I totally agree with you. I think that's exactly right. So one of the components that I want to talk about today, we're going to talk about how you design a healthy MTSS framework that can prevent and address SD. So MTSS really focuses on prevention by providing early intervention and support to those students that are at risk or already experiencing some sort of academic or behavioral difficulties. And MTSS is sometimes a way that students are actually identified for specially designed instruction. I've heard things like the path to special education, right? So if you are looking to prevent or address areas of significant disproportionality, working on your MTSS can help. Essentially asking yourself, are you identifying kids early and getting them intervention as soon as possible? So by using a universal screener in tier 1 for both academics and behavior, you heard me right, there are universal screeners for behavior. But by using both of those, students can really be identified for those proactive intervention supports earlier, instead of really waiting on that old wait to fail model. So in a review of the literature, there were several articles actually specifically notating the positive impact of the early intervention for all students, but especially, Dr. Quinn, you'll like this one, especially students that are considered culturally and linguistically diverse. When applied systematically, all students receive that proactive behavioral and academic supports that they really need to succeed in school. And when we have those 3 tiers, right? Some people have 5, some people have 2, kind of depends on your system, but the 3 tiers, universal, targeted, and intensive, provide students with that tailored approach to receiving the right level of intervention tailored right to what their needs are. And students that receive these supports and interventions may still have a disability that requires specially designed instruction. And even when we start thinking about specially designed instruction, when you are going through that referral process, under the category of specific learning disability, schools have to determine that the learning problem is not primarily the result of a visual, hearing, motor disability, intellectual disability, emotional disturbance, or of, and this is important, environmental disability, environmental, cultural, or economic disadvantage. So this really requires school to also consider that factor of limited English proficiency, right? And so that proactive and tailored support provided through those 3 tiers of MTSS can really help teams ensure that environmental, cultural, linguistical factors have been considered throughout that child's educational career. And so again, providing that early intervention is key. Okay, so let's take a look at our next example. I love this activity. You've probably seen it, but we're going to do it together. We're going to talk a little bit about how important it is that decisions in an MTSS framework are data-based. I would say it's at the heart of what we at the Center on Multi-Tiered System of Supports really believe. But the importance of data-based decision-making can be found in this quick activity. So take a look at these two lines. Don't get tricked. Which one is longer? You don't have to say, just think in your mind. I'll give you a second. Yeah, so the lines, they're the same, right? So our intuition really can be deceiving. Our perception of how things appear is not always correct, right? Based off of initial gut reaction. While initially these two lines really appeared not to be the same size, after we asked some more questions, we gathered some more data, we were able to determine they're exactly the same size. So in this way, it's equally imperative that we don't make those same decisions about students without really having that data to do so. And so having that accurate data, I cannot stress, is essential in a healthy and robust MTSS framework. Really, sometimes when we look at students, we have a preconceived notion about how they're going to respond to intervention, or even may recommend that they're referred to as having a disability without even having some of that intervention. I used to work in a really small and rural school, and there were things said like their dad had a disability. You know, they don't really need to intervention. We know this family, right? Or this kid's just not fitting in with the rest of my kiddos, right? Well, this sort of logic without making these decisions based on data can inadvertently contribute to that issue of significant disproportionality. And it really can lead to those high levels of students that are identified in certain categories. So for example, something that we see quite often in the field is that students that are emergent bilinguals are often recommended for special education services because of their language barriers, or their language needs, I should say. And we know educators aren't doing this for nefarious reasons, right? But more because they feel like students need more support that they really can't offer. And so then this really causes districts to cross that state risk ratio for SD in the area of identification for students that are Hispanic often. And so really when we think about the core of MTSS, building it so that these students in these circumstances can receive proactive supports that they need, right where they need them, right in the right timing, and not be that falsely identified as having a disability. And database decision-making is a cornerstone to that MTSS framework. Again, I want to stress universal screeners. I think most of us are doing those, which is awesome. But that progress monitoring piece is equally important, and it's really difficult to do. So from the universal screeners to the progress monitoring, decisions on what level of intervention a student receives and how they respond to the intervention is really grounded in those data points. As students move to more intensive supports provided through an MTSS framework, they do so through the use of really concrete cut scores and their response to intervention, right? And so this provides you a more concrete objective process in which students receive access to interventions and relies less on those subjective gut check, gut feeling, anecdotal methods. So in this way, we can effectively reduce the number of students that are inappropriately identified for special education and reserve special education services for students that truly, truly need it. We also don't bog down our system too, right? If we have so many students receiving the most intensive services, that's a lot of resources that we're using to be able to do that. So employing an MTSS process that relies on database decision-making, districts can really build and sustain a more equitable system for all students. But it's easier said than done, and I recognize that. Also, much like our last example here of database decision-making, the MTSS framework really provides that opportunity for decisions about a student to be made by a larger team, right? This applies to either MTSS leadership team or even your student support teams. But through the use of a diverse makeup of an MTSS team, they can really change the processes and procedures that inequitably affect student groups. So when they see something in the process that isn't working, they're able to quickly pivot because you have so many of the core members of a school on that team. And a robust MTSS team could include membership of all of these categories. So an MTSS coordinator, a school-based administrator, special educators, general educators, a family engagement specialist, a data coordinator, and I know, gasp, student representatives. We can have some student representatives on this team as well to let us know maybe we thought our behavioral processes were working this way, but that's not how it's being communicated out to students. It's a really important key component. So each of these members really do have a unique job on the team and can really ensure that decisions on students honor both our data, but also that students' cultural and linguistical background. And last, I just want to throw this up for consideration as well. MTSS really helps to implement discipline alternatives. So even though we have high quality instruction and support have been shown to have really effective alternatives to suspension and classroom removals, schools still are using suspension for even minor acts of misbehavior. I've worked with more than one district where we pull the data and they're suspending kids for, you guessed it, being tardy to school too much. You're coming late to school, so don't come at all. We're going to suspend you. Nationally, I'm going to throw some numbers at you. Nationally, students with disabilities make up about 14% of the overall enrollment in our public schools, but they actually represent 24% of our out-of-school suspensions, 18% of our in-school suspension, and 17% of our arrests. When I was a teacher, I talk about I never had enough time. We don't have enough time. Well, check this out. Over 3 million missed days from school were due to out-of-school suspension for students with disabilities. Let that sit with you. This really is creating the condition for significant disproportionality. And yes, these data are specific to students with disability, but any student that misses school, especially for behavioral reasons, it really has significant negative implications on that student's academic programming. Districts then should be open to other alternatives to discipline outside of just suspension and expulsion, and really focus on creating that positive learning environment for students. So districts best support the needs of all students when that learning environment we know is engaging and responsive. And this really can be done within your MTSS framework at the district level through those school-wide expectations. So really that's the teaching of those social and emotional behavioral competencies. And then as students move across school to school, the expectations are consistent. Classroom to gym class to cafeteria, cafeteria to hallway, right? You're having the same behavioral expectations across the school. And also from school to school, right? Elementary to middle to high school, that complete lineage of school-wide expectations carries through. And then when I think about my folks in the room that are educators, what does this look like for you? Well, this looks like proactively teaching your students classroom expectations. So you may have some classroom rules like be respectful and be responsible, but being respectful and being responsible to you could look way different to me. And therefore teaching students explicitly what it looks like to be respectful and responsible, and then acknowledging them when they implement those expectations is such a great strategy to providing a positive behavior support. And I can't stress this enough, we're nothing if not researchers first, bringing research to practice. But when you implement this within a 3-tiered model, positive behavioral supports result in improved outcomes, so improved academic achievement, reduced bullying behaviors. I'm sure we could all afford to have a few less bullying incidents, significant reductions in inappropriate behaviors, the reduced use of exclusionary discipline like in-school and out-of-school suspension, and then the reduced use of restraint and seclusion tactics. Again, trying not to put our hands on kids if we don't have to, by building a more an alternative to traditional discipline. So those are the 3 things I'm going to leave you with today. So let's review them really quick. So first, MTSS provides a systematic approach to providing that early intervention and support for all students through those 4 essential components of MTSS. So we have database decision-making, progress monitoring, universal screening, and multi-level prevention systems. This approach, being systemic, provides a more equitable system for all students and really can help prevent and address those issues of SD. Next, we also discussed that hallmark of MTSS is database and team-based decision-making. We have all sorts of resources on our website at the Center for MTSS for Success really leading you to make more database and team-based decisions, but really stressing the importance of that and using a highly qualified, diverse team to make decisions about individual students. You really are building a more equitable framework, and that's a great best practice in preventing those issues of SD. And then last, we really talked about how an MTSS framework can provide a focus on those discipline alternatives. So rarely do we see out of school or in school suspensions defer those behavior issues. And really then building a positive, engaging environment that relies on communicating school-wide expectations that are taught and acknowledged can prevent the issues of SD and discipline. Before I move on to the next slide, I want to know which one of these do you think is the hardest to implement out of the three? Systemic approaches to providing early intervention, making data and team-based decisions, or focusing on those discipline alternatives? So throw what you think your answer is in the chat. Bye, Dr. Quinn. Thank you, Dawn. The discipline alternatives. Yeah. Yeah, changing the mindset. And I think Pam, you may agree with me that it's gotten harder as our workforce is depleting. It's harder to find teachers. And then, as an administrator, you have a student, that could be a perpetual issue. And it's you're stuck between a rock and a hard place there. Yeah, constant, stuck between systemic approach and alternatives to discipline. Yeah. So I think you guys are highlighting what my sense is. Yeah, thank you, Anne Marie, for being the one to say data-driven. I think these are all really, really difficult, and they don't come overnight. To build the system of how you do school is really nuanced, really in the weeds, and really difficult. So we want to give you some next steps because all of these are really difficult to do. So given that, so few states are offering technical assistance, so professional development and coaching in the area of significant disproportionality, we want to help. So AIR and the Center on Multi-Tiered System of Support can help you do the following. We can help you build a team. We can help you come in and conduct a root cause analysis. We can help you in your action planning process. How do we get out of SD, right? Or how do we proactively prevent significant disproportionality? A lot of that can be building a really robust framework, and no better place to do it than the actual Center on Multi-Tiered Systems of Support. And then one of the things that I think is rare that we offer is access to those high quality systems coaches. So you can do all of these compliance things by yourself, but when the rubber hits the road and you've got a kid and a teacher pitted against each other, you want a coach to be able to really help you through that process. And so we wanted to make sure that we had a way for you to be able to do that. As an added bonus, districts that are already experiencing significant disproportionality can use the required 15% IDA part funds to really access AIR's high quality professional development and coaching supports. Sometimes I think that we seem like a really big organization, and we are, but there's no better way to be able to access our services than being able to use some of your Part B funding when you already have significant disproportionality. So if you're like, thanks, Sarah, this has been great. I really appreciate the suggestions. Awesome. But if you're like, hey, Sarah, what the heck? I want some help. Well, here we are. We can help you. If you just are asking questions or trying to figure out what's next for you as you're really digging into this complex issue, we want to be there to kind of help you along. So if you're interested, these are all the things that we can kind of provide in coordination with the Center on Multi-Tiered System of Support. Reach out to sigdis@air.org, and we will come back and figure out a way that we can partner with you to really address these issues of significant disproportionality. I didn't get into education for the money. I got in education to help kids. And so I'm so excited that this is a great way to be able to help students and be able to see how we can help the ones that need help the most. And so I want to leave you with just one final opportunity to engage with each other, I think. There we go. But I would like if before you pop off today, if in the chat you could respond to either one of these prompts. What was some new information that you learned? Or maybe what is the next step that you have? What are you going to look into after today's webinar? So I'll give you a minute to kind of populate that, as well as if there are any questions that you have, just throw them in the chat and I'll try and answer. Otherwise, It's been so wonderful spending the last 40 minutes with you. We are so excited that you came and took time out of your day towards the end of the school year to just be a part of this conversation. And we really look forward to supporting you in the future.